Hello, my name is Barbara Avila, and I am the owner of Synergy Autism Center, where I help individuals and families experiencing autism. I'm kind of like a counselor and a coach combined, um, where it depends where a family is feeling a little stuck, whether they need support with being able to talk with one another as a couple in regards to autism or in regards to their child's development. That's something I can help with. But then also getting into the nitty gritty of how can we help someone with autism really have a better quality of life from a social perspective. And that's what I'd like to talk about today. I was doing some reading. I was on vacation and doing some reading in the realm of counseling and autism. And, the hot topic is trauma-based therapy. And the way that I approach it, that I've been so intrigued with, is the fact that the trauma that is experienced in autism is kind of multifaceted. One is, I really truly believe that a child's system is, for whatever reason, experiences neurobiological trauma early on that then heightens or dampens sensory experiences and makes a child really have to go into kind of fight or flight mode early on in development, that then breaks down the back and forth social and joint attention that is supposed to be natural to that age range, that then breaks down and really causes kind of a ripple effect later. And so what I really enjoy doing is talking about that, like what's going on with a child's system or an adult system if it hasn't been addressed yet, from a trauma perspective, and how can we help that person understand that. But then in younger kids, of course, the parents have to understand that. But at the same time, guess what? Parents are going through their own trauma of having to figure out how to parent in a new way with a better understanding. So anyway, so that's what this kind of vlog or blog or whatever is about today, is understanding autism as a response to that neurobiological trauma, and the response being anxiety, as a response to anything that is creates uncertainty. So in autism, we often see that people when their anxiety starts to go up, it's usually because something is novel or new in their environment, or something that they feel like they can't handle, that it's creating a moment of uncertainty, and that's depends on the person of where that is. So that's true for everyone, right? So I want you to take it for a moment to think about uncertainty in my life, for example, is that I love uncertainty to a certain degree. So I love going hiking and finding new spots to go hiking. I love going to new restaurants and finding new foods to eat and things like that to try. Okay, so that's my level of uncertainty. I am not somebody who's going to jump out of an airplane just to find out what experience that is like, although there are people who certainly like to do that. I used to be more of a daredevil and want more uncertainty younger in life, for example, and the older I get, the more I want a little bit more sameness, and I find comfort in that. So anyway, we all are at different points on the spectrum of this, and so are people with autism. And so I have kiddos in my program who uncertainty can be as simple as a different orientation of where their food is. Because the more anxious they're feeling about uncertainty in general, or the amount of change that's happening in their lives, the more they're going to want sameness, and the level of uncertainty changes. So it can be how you cut a sandwich if it's different, the way you travel to school or to grandma's house or whatever, if it's different. That can be enough of a level of uncertainty that really can throw somebody into just panic mode and fight or flight. And I really want you to think about it as being from a biologic or a neurological standpoint. Okay, so and I'm not saying, I want to make sure the message is not to you to think that we have to make everything certain all the time, but there may be needing to meet someone where they are and really get attuned, to use another kind of counseling word, get attuned to that person with autism, to understand their level of anxiety and how quickly it goes up with that level of uncertainty. Okay, if that makes sense. So getting attuned so that then you can give that person targeted practice with miniature moments of uncertainty that they can practice with and they can get more comfortable with, and they can trust that they can handle it. So it is a trust issue, and it isn't necessarily a trust in the people around that person, although that's part of it. But really think about it as a trust in themselves, that they can handle, without going into fight or flight, they can handle a level of uncertainty or a new level of uncertainty that then allows them to learn and to grow and engage socially and have that full quality of life that I was talking about. So I'm just going to break it down just a little bit. So the first that I feel like is that we need to understand autism as an anxiety disorder and a response to neurobiological trauma that was probably experienced early in life that stops a person from being able to be curious about things that change, and that invoking that curiosity about the uncertainty, so needing to shut it out. Okay, so our first job is to bring down that anxiety, and one is stop repeating the trauma. And so usually some of my first assignments to families and teams that are really dealing with some pretty significant behavior is to, okay, let's bring down the uncertainty. And it's not because that's going to be where we are forever, but we've got to calm everybody's systems and then be able to do it more mindfully of bringing the uncertainty back up to a level that the person can handle and feel confident and competent in handling for themselves. So the first is by stopping the trauma, and then and it's really to their system. And the way that we can do that is to bring your own calm to the party. So that's the first thing I talk about, that we have to address that. So you have to bring your own calm to the party and figure out how to do that. It is no small feat. When you have a child or in your classroom or a partner that you are in a relationship with who has autism and is dealing with this kind of level of trauma around uncertainty, you have to figure out how to keep yourself healthy and calm so that you can do that attunement I was talking about a minute ago. So that's the first thing, bring your calm to the party. Second thing, stop talking so much. So I do a lot around talking to families. I talk a lot about not talking. It's funny. Where sometimes talking is with somebody who has auditory processing needs is really just adds to the anxiety, adds to the uncertainty, even though you are being so kind and trying so hard to explain something, it really probably is making it worse. So that's usually my number 2 thing. My third thing is guide versus tell. So it's kind of linked to that one of not talking so much, but really trying to think about the fact that calming your system and guiding someone to new understanding versus just telling them is going to be the most helpful way to stop that repeated exposure to uncertainty that feels so unmanageable. If you're guiding them through that process of figuring out how do I manage uncertainty and you're attuned with them, you can guide them to new learning and feeling more confident. If you just tell them you should do this, you can't do this, you need to do this, whatever, that's not going to work. I'll just tell you right there. It just really isn't. And then the fourth thing in that whole realm of how to guide someone, of bringing your calm, stop talking so much, guide versus tell. The last one is slow down. And again, listen. And you can't attune to someone and truly listen to them and what's going on with them in those smaller moments of uncertainty unless you're slowing down and really attuning to them. All right. And then and only then, once you have all of those pieces, is then when you can provide opportunities for uncertainty to come from you as the person's most trusted guide or mentor around these things in ways that really can spark curiosity rather than overwhelming regarding the uncertainty. So this is going to happen in very small doses. Some of you have heard me talk about my CTU concept, which is curiosity to you. which is key to this. If somebody is not curious about you, it's probably because they're re-experiencing that trauma of not being able to manage uncertainty. And so we need to figure out how can we support them in being that calm person who brings manageable uncertainty so that they are going to be curious about me and what I bring to the table. So that's the CTU concept. If you want more on that, please, I love talking about it. Contact me directly, or you can find more information on my YouTube page and things like that. And then the last part, so small doses, curiosity to you rather than objects. We want you to be the one who's delivering the uncertainty that is manageable. And the last thing is adjusting as needed. So that's really back to that attunement process. So I'm going to try and summarize. So I'm always thinking about the combination of counseling and coaching and autism for parents and for individuals and teens and adults with autism. And recently I was really struck by the idea of trauma-informed care or counseling, which is usually in regards to things like assault and things like, horrible things that kids have to deal with in our world, which I won't go into. But where autism comes in is it isn't from an outside entity necessarily, but it is trauma that somebody with autism is experiencing, but from a very different perspective. So imagine their sensory system is so much more fragile early on that they can't necessarily, at least effectively, manage levels of uncertainty. And then the more uncertain, that's part of childhood, is everything's uncertain, right? And you look to your parents and you have that joint attention, that social interaction, and it just, it grows and mushrooms quickly. So that's where we're trying to, where I'm trying to support parents. And understanding that, and then being able to address that to then give the practice that is so essential for someone to be as successful as possible and have the quality of life that they deserve. All right, thanks for listening.